Hello, my name is Patty Mantilla, and I'm here today to talk with you about monitoring intensity of exercise. Intensity of exercise can be measured in a number of different ways, the most accurate of which is measuring volume of oxygen, or VO2. The little dot above the V stands for liters per minute. Although this is the more accurate method of assessing intensity, it requires more extensive equipment, and it's not usually found in a health club setting. And primarily for that reason, we use heart rate. We can use heart rate because there is a linear relationship between volume of oxygen and heart rate. So if you were to graph these during a workout, the end result, and plot them, the end result would be a relatively straight line, meaning that you can predict one from the other because of this relationship. We also use the talk tests, the RPE, relative perceived or rating of perceived exertion, and METs, metabolic equivalents. METs are discussed in another video, but one MET can be expressed in terms of kilocalories or milliliters of oxygen, each per kilogram per minute. Heart rates we use during exercise would be resting heart rate, maximal heart rate reserve, training heart rate range, and recovery heart rate. The resting heart rate is the heart rate first thing in the morning, and that is usually between 60 and 100 beats per minute. And it's important to us because we know that as an individual becomes more fit and the heart becomes stronger, the stroke volume would increase. If the stroke volume increases at the same workload, then heart rate would decrease. So a lower resting heart rate would be indicative of a higher level of fitness. Now, it is also genetic. So it could be that you have someone who is fit and has a high resting heart rate, or the opposite, has a low resting heart rate, but it's just genetic, not fitness. Maximal heart rate is the highest rate your heart will go in a normal rhythm. It is not influenced by fitness. It is influenced by age, and that's why we use age in the formulas to predict maximal heart rate. The most commonly used formula is 220 minus age to estimate max heart rate. So if, for example, I was 20 years old, my max heart rate would be 220 minus age. Another formula that can be used to estimate maximal heart rate is 207 minus 70% of your age. So the first step there would be to multiply your age by 0.70 and then subtract that number from 207. Each has a margin of error, and not everybody fits in this average range, so keep that in mind. Recovery heart rate is that used after the cool down, and that should, an individual should be able to recover within a few minutes, maybe 3 to 5 minutes, and if they can't, it probably means they worked too hard, that they should work at a lower intensity next time, and that they will need a longer recovery so that they can avoid blood pooling. Heart rate reserve is what I think of as the usable range. In other words, you're never going to go above max. You're never going to go below resting. And so the area between those two is the area that one would exercise. So to calculate heart rate reserve, you take your theoretical max and subtract your resting heart rate from it. So if my theoretical max was 200 and my resting pulse was 60, then my heart rate reserve would be 140 beats per minute. Training heart rate range is the range that you want to exercise at to ensure a training effect but not overexert. There are two formulas, the simple and Carvonin. The simple formula is easy to do, and you don't need to have their resting heart rate to estimate this. The Carvonin formula does require a resting heart rate, but it is more accurate because that takes into account an individual's fitness level. To do the simple formula, the range that we'll use is 64 to 94% of the theoretical max. with 64 being the low end and 94 being the high end of the training heart rate range. Again, not everybody will fit into this. If you have somebody who comes in who's deconditioned, you might want to use even as low as 60%, or even lower if you needed to. To do this formula, you would take the maximal heart rate and multiply that by the percentage of the intensity desired. So let's look again at our 20-year-old. The age predicted max, 220 minus age, would give us 200 as our theoretical max. If you multiplied the theoretical max, or 200, by 64%, you'd come out with 128 beats per minute, and that would give you the low end of the training heart rate range. To get the high end, we'd multiply our theoretical max, or 200, by 0.94, 94% of the max, and that would give us 188 beats per minute. So that would be the client's training heart rate range, 128 to 188 beats per minute. Again, you're not going to give the client a whole range and say, okay, anywhere in here. You're going to narrow that down a bit based on their individual goals, their health, their fitness level, the duration of exercise, the frequency of exercise. Here's where the art comes into play. You have to be able to really listen to your client and help them meet their goals. The Carbonin formula is a little more complicated. Not too complicated, but more than the simple formula. And if you look at these first three, they're all saying exactly the same thing. 220 minus age is the age predicted max. If you subtract the resting heart rate from that, or age predicted max minus the resting heart rate, that's the same thing as the heart rate reserve. So the first step in this formula would be to take your theoretical max, 220 minus your age, and then subtract the resting heart rate from it. You always do what's in the parentheses first, then what's not separated by a symbol, so the percentage, and the last step would be what is separated by a symbol. So let's take a look at an example below. Step 1, subtract 220 minus age to estimate your max. Step 2 would be to subtract the resting pulse from your theoretical max. That would give you the heart rate reserve. Step 3 would be multiply the heart rate reserve by the low end of the training range. And then the final step would be re-add the resting heart rate. Because we took it out of the equation, we need to put it back. And then again, you'd repeat this same formula using the high end of the training heart rate range. And for the Carbonin formula, that range is 50 to 85%. But again, if the client was deconditioned, or maybe they just have health goals, you could use even as low as 40%, or even lower if you needed to. So let's take a look at an example of this. So the range that we're going to use is 50% to begin. We'll start by subtracting, follow along with the cursor here, 220 minus age would give us 200, and then subtract the resting pulse, which we asked our client and found out that it was 60. That's just my example over here. So 200 minus 60 is 140. And then remember, you're going to do what's not separated by a symbol. So we'll take that 140 and multiply it by 50%, and that would give us 70. And our final step is to re-add that resting pulse, and our low end then becomes 130 beats per minute. To do the high end, we're going to follow the same formula but use 85%. So we'll take 220 minus age gives us 200, minus the resting heart rate brings us to 140, and here we are. 140 times 85% gives us 119, and the final step is to re-add that resting pulse, which brings us to 179. So for this client, our training heart rate range at 50% is 130, right here at the bottom, and at 85% it's 179. So we would tell this client somewhere between 130 and 179. Again, it would be wise to narrow that down based on the client's goals, health status, fitness level, duration, frequency of exercise. Remember, you can use a lower training heart rate range if you feel that's warranted. With a simple formula, we normally use 64 to 94%, but it would be okay to drop it down to 60 to 94 or 50 to 64 even, any level that allows them to exercise safely. Using the Carvonen formula, which is based on the heart rate reserve, 50 to 85% is the range recommended, but you can feel free to go even lower if you need to based on their health or fitness level. Remember, anything is better than nothing. If we can get people moving, we're having a positive influence on their health and well-being. So looking at these two formulas, they're not the same. It's like measuring apples and oranges. One formula gives you a percentage of the max, and the other gives you a percentage of the heart rate reserve. So you'll see this is particularly important when you're working with people at a lower intensity, which would likely be more deconditioned, because the range or the difference here is going to be larger than it would be over here at the high end. So what I'm saying is, with your new clients that you would more likely use the low end, you really want to try and get that resting pulse so that you can really hone in on the appropriate heart rate. The Borg scale that I mentioned, or the RPE, rating of perceived exertion, the original scale was designed as a 6 to 20, with the idea being that the individual gives you a number, say 12, for example. Your client says, yeah, well, I'm a 12. When they check their heart rate, it should be 120 beats per minute. And that's sort of to teach people how to gauge the intensity. But then they came out with a newer and a little easier scale to use, a 1 to 10. And your client should be somewhere between 5 and 7 here on the 1 to 10 scale. This is similar to what you might see in a doctor's office when they say, how bad is the pain? And if you say 10, they're going to say, go to the emergency room, right? If you say 3, they're going to say, I'll put you back to the front desk so you can make an appointment. You may also see a similar scale called the dyspnea scale, which would be used for people with asthma or respiratory issues. And it's a similar setup, 1 to 10, and 10 being you really can't breathe at all. That's the end of our presentation. So hopefully you found this helpful, and I look forward to meeting you at the next video. Thank you.